Welcome, ladies and gentlemen, to the Utah Story Show. On this program, a very important episode, we will be discussing the trade-off between unemployment and basically keeping people out of work and the social ramifications of that. What we're specifically talking about is increase in suicide and opioid overdoses, drug overdoses, and the terrible trade-off that we have with, keeping people safe and reducing the death rate. It's probably the number one debate in the entire country. It's the most important debate because we're seeing protests all over the country in cities where the shutdowns have been the most severe, people out of work, people wanting their job back. I believe these protesters have very valid points. And as I've mentioned on the program before, for every percentage increase you have in unemployment, there is about a 3 to 4% increase in suicide rates, in addiction overdoses. And so we have a very special guest on the program with us today who runs a drug treatment center, and we're going to be getting to that a little bit later. But first, I wanted to share with you some statistics. 16 million Americans applied for unemployment benefits in the last month. So what are the social ramifications of that? This is according to Johns Hopkins University. Unemployment will lead to increases in suicide, substance abuse, domestic violence, homelessness, and food insecurity, wrote Johns Hopkins professors Stefani DeLuca and James Coleman, explaining the costs of social distancing disproportionately impact the poorest and most socially vulnerable. Thousands of people will die from these causes, and many more will be severely injured and traumatized for life. The situation has created a grim trade-off between saving lives, they wrote, saving the lives of those who are most vulnerable to COVID-19, versus saving the lives of those who are most vulnerable to suicide, substance abuse, and domestic violence. There's further research on this from the National Bureau of Economic Research. I have a link to that I'm going to want to share with you. In a 2017 study, a team of researchers found a connection between the shocks of the local employment rate and the increases of opioid overdose deaths. The data suggested that every 1% increase in unemployment was associated with a 3.6% increase in opioid-related overdose deaths. With social distancing in place, how do people currently suffering from drug addiction get treatment? So I'm going to call on my phone now someone who is dealing with exactly that. Her name is Anne Boulter, and she is with Private Detox of Utah, and Anne has agreed to come on the program.
This is Anne.
Hey, Anne, it's Rich again from Utah Stories. How's it going?
Good. How are you, Rich?
Doing well. I think I got this going. Yep, I do. Tell me a little bit about Private Detox of Utah. What is your organization? What is it you guys offer for people in normal times?
So what we do is called in-home medical detox. And so it's the same type of medical detox that you would get at a hospital or a detox center, but we're able to do it within the comfort and privacy of a person's own home. So it allows the person to stay home, be treated. They have a medical provider who comes to see them every single day. They'll provide medication for them, and then we help them find a recovery program.
Okay, so you're not a recovery program. You just help with the detox part, and then you refer them to a recovery program.
Yeah, so in Utah in particular, most of the recovery centers do not do the detox in their center. They're almost always separate. I think it'd be nicer if it was a little bit more combined, but it's not. So if someone's looking to get into recovery, a lot of times they'll go to a center, they send them somewhere else for detox, and then they're hoping that person comes back. But we find a lot of times people don't want to go to a program because the whole thing's scary. Detoxing is really an intimidating process, and so a lot of times people won't do it. But if we can come in there and make that first step easier, then it's easier to also speak with them about getting into a program, because detox is definitely not recovery. Detox is actually an easy part.
Yeah, I'm sure detox, especially with opioid addicts, is extremely painful and difficult. Would you say that most of your patients are on the lowest end of the socioeconomic spectrum, or would you say it's more suburban patients, or what are you finding out there right now during coronavirus?
We're starting to hear more from your mid and upper income individuals. And I think that this is a population that doesn't get a lot of attention when it comes to the opiate epidemic, because there's a lot of what you would call functional addicts and alcoholics. These are people who can maintain a job or responsibilities, take care of their family, but also have an addiction issue at the same time. And they fly under the radar. And there's more of those than I think people realize. For Utah, as an example, we are 7th highest in the nation for opiate overdose, and yet we are 7th lowest when it comes to poverty. So the majority of our addicts and alcoholics aren't always the lower socioeconomic or homeless, seems that's where media focuses a lot of attention. But truly, it's our friends, our family, it's our neighbors. These are the people who are addicts and need help too.
And have you seen a surge or an uptick in the number of people giving you guys a call now?
A little tiny bit, but I would expect it's going to be coming more as we get further on. A lot of times in the beginning of this, scenario, people are starting to use more. And I think they'll get into a spot where they're like, okay, this is out of control. But I think there's going to be a period of time where people are overusing the substances, and then that's going to result in having to detox and get into treatments too.
And so related to public policy, I don't know if you've seen the studies, but I've just cited some studies that for every percentage increase of unemployment, there's about a 3 to 4% increase in drug overdoses and suicide. Have you guys been around long enough to see that that's often the case, or with your own business, or do you know about those studies?
Well, it's definitely the case, and almost all the studies will show that same thing. Where my business, I started it about 2 years ago, but I've been working in the addiction industry for at least 6 years. And that's always a consistent pattern. So you do see, say, when I did in-hospital work or the ER, you do see people coming in who have had unemployment. They don't have good socioeconomic status, and you see them more often in the ER because that's the only resource they go to, as opposed to other people who are looking either to their doctor or somewhere else to get help. But it's definitely a correlation, absolutely.
Yeah, and I'm sure that due to the lack of resources of many of those people at the bottom of the socioeconomic ladder, they're just probably end up going to the ER, and that's the only choice they have. And
yes, and actually getting that even into the ER and getting the right treatment or help there is really tough too. It's a really complicated situation, and it's unfortunate.
Yeah. Well, I appreciate you coming on. Do you have anything to say to people who are perhaps really suffering right now with substance abuse due to the lockdown, and what they could do to maybe get help sooner rather than later?
Yeah, absolutely. Well, we have two different types of people: the people who haven't sought any treatment yet, that have been dealing with it, and then also people who are relapsing and falling back into old patterns. Just because addiction is considered a disease of isolation. So even in the definition of that, people develop a tendency to gravitate towards a substance, and they're compulsively using a substance rather than actually having a relationship with humans. So nobody recovers on their own. This is definitely a scenario where you need support of others. And for those who are worried or starting to have problems with relapse, the things that they relapse from is usually anxiety or fear, depression, stress, lack of structure. lack of routine, and then the social support. And so these are all components that are really strong right now that need a lot of attention. Currently, there are recovery centers are trying to make different options available so we can get people into treatment. It is taking a little bit longer. Most places are having a policy where they have a certain period of quarantine. We're able to do tests on people before they come into treatment. So that whole process has come to be a little bit longer, which is hard for a lot of people, especially when they're having anxiety and depression. And then if they don't have the ability or not able to go into treatment, the things to do to stay safe is, number one, reach out to those social supports. And, physical distance is different from actual social distance. A lot of times people rely on the 12-step meetings, smart recovery, these types of scenarios. And if you look online currently, there are lists of places where you can go on and do a Zoom meeting. And so they've tried to make it really easy. It's still difficult because an addict and alcoholic knows they can go to any city, any time, and there's probably a meeting somewhere almost every hour. So that's been decreased. Other things to do is to try and keep your life as structured as possible. When people don't have structure, that's when they start to get bored or they start to have more stress and anxiety. So structures, it's a good time to pick up an extra hobby. Exercise is a huge factor, and it doesn't have to be hard exercise, but getting that physical movement in. They have recovery-based gyms around here, especially in Salt Lake, and they are doing some online classes too.
Well, that's great.
Also, pardon?
That's great. What I would like you to do, if you can, is email me some links to those resources, and we'll put those in the show notes when we publish this online, and hopefully help people out with that. But that sounds like all great advice. I think that you're absolutely right that a substance tends to replace your former relationships that you had with your friends, and maybe you're not going out anymore, maybe you're not enjoying life as much, and of course you're not seeing people, so it's easy to take a substance and use that as a substitute. And I think, like you said, exercise, that's what I've seen to be the most effective with people I've known who have substance abuse problems, is just replacing the substance with exercise instead. And
sometimes the most natural things, including exercise, getting good sleep, nutrition, all of those play a huge role that I think isn't recognized a lot of the time. But you got to get those parts in order, and then just that social connection is so important right now. And I think that's the hardest. It's hard for people to reach out in general before this started, and now it's really easy for people to isolate and get right back into those habits.
Yeah.
So it's a precarious time right now.
Yeah. Well, thanks so much for being on the show, Anne. I really appreciate it.
Yeah, thanks for having me.
Yeah, and if you could email me, richard@utahstories.com, just all those links and info, we'll publish those in the show notes and the story as well when we put it out there.
Okay. All right. And then I don't know if wanted to know about different ways that people are being affected from the addiction standpoint or not, but I can always fill you in on any of those topics as well.
Yeah, let me know more about that, and maybe we can have a follow-up. We kind of need to keep our episodes about 20 minutes, we found.
Oh, okay.
And so maybe we can do a follow-up in another month or so.
Okay, that would be good.
Yeah, because this is definitely going to be a huge, huge issue, I think, and especially in terms of the trade-off of reopening the economy with the high unemployment rate and how that trickle down happens in the coming weeks and months, and how it all pans out with such a high unemployment we haven't seen since I don't think we've seen this since the Great Depression, such a high unemployment rate so quickly.
Exactly, and the fact you bring up the percentage rate increases with the unemployment, that's an absolute truth. But part of that is different people on socioeconomic statuses are falling into unemployment too.
Yeah.
So it's going to be tricky. It's scary for a lot of people.
Yeah. Okay, well, have a great day. Thanks for coming on, Ann. Appreciate it.
You too. Yeah, we'll see ya.
Hey, talk to you later. Again, that was Anne, who is with the Private Detox of Utah. We're going to have a bunch of links that you can follow in the show notes, in the YouTube video, and on utahstories.com on our description of this. And so, again, I think what she said that was the most important and that I've realized to be true in my own life is you really have to maintain that structure of your day. One thing we're talking about in the future program is the federal government is actually putting in place greater benefits to remain unemployed and not take a job than you will get likely from your employer. It's a very difficult position because a lot of people would rather just enjoy the 4 months of summer unemployed than go back to work if they're going to get paid. I mean, that's the part about the federal benefits I don't understand. You need an incentive to go out and work. But my recommendation is, yeah, you could stay unemployed. You could get those benefits, but your life is going to start breaking down. Your routine is going to start breaking down. Your hygiene, you're probably going to be drinking more. It's not going to be good for you. Everybody needs to work. And so what we've really realized in our lives is that structure, waking up every day and doing the same thing, waking up with a great routine that you can enjoy and appreciate, and then, of course, working hard, that makes a huge difference. So for me, it's exercise. If I go running 5 miles with my dogs, I have to go at least 5, 6 with Joey, my Irish setter. He goes nuts. If it's less than 5, he'll just start beating me up in the middle of the day. But if I can go out and do that and then come back from my run, plan my day with my wife, plan with what we're doing with the kids. We take turns with the kids, basically trying to have one-on-one time with each kid each day. That makes a massive difference. And I think if you're single, it's funny, this person down the street from us, they have 2 trees in front of their house. They just set up a hammock between the 2 trees, and this person is sitting there all day long in this hammock reading a book. I've seen them there for like the last week. That person doesn't look so happy anymore. The first couple of days, it was like, man, that's a great idea. But it's like you just can't relax all day long every day and maintain your sanity, your healthy habits. You just need to work. So that's our show for today. I want to thank our sponsors. I really, really thank our sponsors for sticking with us with this show. The magazine. We are looking into whether or not we're going to be able to do a May issue. We have a plan in place. We just need to get sign off from our advertisers whether or not this plan will work. Because, we let every advertiser out of the magazine who wanted out. But now for May, the economy is reopening. Our other episode is all about that, and it's our plan for that. But I want to thank our sponsors, especially, who make this show possible. The Utah Stories Show is brought to you by Canyon Meadows Grass-Fed Beef. Located in eastern Utah are the beautiful Altamont pastures where there are some extremely happy cows who I've personally met. They are so happy because they spend their entire lives fed on green, lush, rich pastures. And if you haven't tasted the difference in pasture-raised beef, where the cattle spend their entire lives in pastures, eating grass as they're supposed to, as opposed to factory farms where they eat corn and they often get sick, you need to taste the difference. And this is actually a very important time to stock up on meat, because we just heard in the last few days Tyson Foods is closing down meat processing facilities. Our supply chains are getting interrupted, especially for meat. So limited supply is really the key word. So you really should act fast. Go visit cmrbeef.com. They offer pickup locations in Utah. I would suggest you order a lot and put it in a deep freeze if you've got one. It is seriously the best meat. It's healthier. It's far more nutritious for you than regular factory farm beef. Go visit cmrbeef.com. There's a phone number. You can tell them you heard about them on the Utah Story Show. That would help us out. It's seriously a much, much better product than factory farm beef, and we are never going back to factory farm. The Utah Story Show is also brought to you by the Carpet Barn. The Carpet Barn is located in South Salt Lake. They've been in the carpet business for over 40 years. Their staff is friendly and helpful. They have a huge selection of carpet. And if you are looking to save some really good money on your carpet and you want to support an amazing local business, go visit them. I just did my entire basement with the super amazing plush high thread count carpet that would have costed somewhere around $18 a square foot. It's about half off of the Carpet Barn because there's some sort of little problem you really can't notice, and they'll show you exactly what the defect is. But I could not. They rolled out the carpet. They showed me the pattern. I could not tell what the difference is, what the defect was. And it's just this amazing carpet, and I have it all through my basement, and we love it. It's so much more cozy and comfortable down there, especially with you staying at home a lot. Go visit the Carpet Barn. Google the Carpet Barn. They're in South Salt Lake. They will totally hook you up. And tell them you heard about them on the Utah Story Show as well. And with that, we have picked a date for our upcoming craft beer festival. It's our Brewers Fest. We had to change the date. We have picked the date of the second week of July. I believe it's July 11th. And check out madeinutahfest.com for more information on that. We will have the very best craft breweries in Utah at this festival. It's going to be at the Gateway. We are anticipating that social distancing rules will still be in place. We will be making accommodations for that by limiting the number of people who will be in the big indoor space at one time. But it's going to be an amazing time. I think it's a good time for you to go book your ticket so you have something to look forward to in the coming months. We knew we were going to be rescheduling it. We didn't know the date. We've picked out the date. So visit madeinutahfest.com for more information on our amazing beer festival. I was looking for the ad. I finally found it. That's it. The date's changed. That's all that's changed. And we will have a wonderful time when we put on that festival, and I hope to see you there. So that wraps up this episode. I hope you'll follow us on Instagram, subscribe to us on YouTube. I love getting comments. I love hearing your feedback on this program, what we're doing right, what we're doing wrong. If you're brand new to this program, I suggest you take the 5-episode challenge. Go check out what it is we're doing here. We're all about finding truth, supporting liberty. We're about small businesses, maintaining the social fabric of our communities in Utah. That's what the Utah Stories magazine is about. That's what the Utah Stories show is all about. So if you like those ideals, subscribe to us on YouTube, subscribe to our newsletter, even more importantly, at utahstories.com. The newsletter is our social platform. We are not allowed to promote our posts on Facebook, and Facebook has not told us why that is. Interesting that a lot of independent producers are in the same boat as we are with Facebook. So now more important than ever, subscribe to our newsletter at utahstories.com. This program is produced by Tyler Bond and Connie Lewis and Golda Hukic-Markosian. They make it possible that we are putting this on, and it's you by supporting this show, by subscribing to our newsletter, watching it, liking it, that it's all made possible during these challenging times. So I thank you so much for watching. Until next time, this has been Rich Markosian. I will see you next time.